You've heard that cannabis can be good for chronic pain. Today, we're going to talk about a certain type of pain with nerves. Neuropathic pain is a common complaint. We're going to teach you how to use cannabis to help. Welcome back to Discover Marijuana. I'm Tim Pickett, a medical cannabis expert. I'm here with Blake Smith, a bioanalytical chemist for Zion Medicinal, and Josh Fitzgerald, a pharmacist in charge at Deseret Wellness Medical Cannabis Pharmacy in Provo. We're talking today about neuropathic pain. This is something that's common in diabetes and in other conditions. And we know that cannabis is good for chronic pain and physical ailments. We know we can use it to get off of opioids or to reduce opioids, but neuropathy, it's kind of specific. Blake, run us through what cannabis can do for neuropathic pain and other cannabinoids too.
Yeah, so specifically, unlike most chronic pain, you'll get this instant onset of extreme pain, usually very quickly. Like all of a sudden I sat too long and now I can't move. My leg hurts so bad. Or you almost feel like you're dying in some way, shape, or form. Like there's specific types of feelings around that. So really at the very first stage, if it's debilitating, you need to, do whatever you got to do to get out of that pain state, right? And so typically most of what THC does is mask that pain, which is actually okay in this particular case, because what you're really trying to do is you're not fixing hurt nerves or dead nerves.
Right. I'm not going to adjust my spine and reduce the pressure with cannabis.
Yeah. Smoking doesn't realign my spine.
Right.
I mean, that'd be awesome, but that's not how that works. And so usually inhalation methods are also the best to do for that because it'll hit you the quickest, right? There is some evidence that suggests that there are cannabinoids that can actually help with neuropathy. For example, CBG. There's some papers out right now that are looking at CBG. The problem is CBG is not extremely readily available yet. And so there's not a lot of products that have it in there.
I've heard CBD is somewhat neuroprotective also.
Yeah, it is neuroprotective, but what we don't know is whether or not that actually inhibits signaling across or it's actually helping that nerve to function in a more what we would call typical manner. Yeah. And so there's just not a lot of information around that yet. If your nerve pain is also a result of inflammation, I'd immediately recommend stuff also with CBG, things to take down your inflammation. If it's because of like a broken femur or something along those lines, yeah, I think we're talking about pain mitigation. That's really what we're doing because THC is not going to fix that.
Josh, walk us through some products that might help this neuropathy.
And when we talk about neuropathy, it can be a bunch of different things too. So it can be a systemic neuropathy. It could be a specific area of neuropathy. Yeah. And so we have to kind of treat it in that sense. When we're talking about systemic neuropathy, it's like fibromyalgia, that's just a rampant type of neuropathy. We need to treat the whole body itself. So we're going to be looking for gummies for pain control. We're going to be looking for vaporization methods for immediate pain control. We're going to be looking at tinctures to control pain in specific times also and bridge some of those gaps too. So there's different things to use for different things. Now, going back to like specific areas of neuropathy, I'm going to lean upon the creams that we have available to apply to those areas and mitigate some of that pain in that area. Like Blake said,
the topicals are surprisingly effective.
Oh, I love them. So I have an ankle injury myself, and I've been able to start using it for myself, and it's been life-changing since I go out and run again and be able to manage my pain before and after my running. But we have these methods that we can pinpoint to specific areas of our body that are available to us, and we definitely need to utilize them and talk to the pharmacist. Please talk to the pharmacist to help you through that process.
Do you have, and because when I'm talking to patients, I'm using this idea that maybe we don't have tons of evidence that CBD is helping, or we don't know how it's helping. But I'm typically telling patients, hey, we need to use more CBD with neuropathic pain just because it can be part of these products. And how can it help?
So one thing we do know about CBD is CBD fits into lots of channels. neurotransmission reception sites. And so because of that, that's why people talk about CBD helping with anxiety. It helps with pain. It helps with inflammation. It helps with sleep. It seems to be this like magic thing.
It helps a little with everything.
Yeah.
Right. How does it do that? It's not because you're getting a really good connection. It's like a key that'll go into a lock but not turn it, right? Because of that, for neuropathic pain, you're getting pain signals from that nerve constantly. And it's constantly telling your body, I'm in pain, and you're having histamine reactions, you're having epinephrine, you go through your normal sympathetic nervous system reaction to pain. CBD does bind in some of those sites, but not to send pain signals, but blocking that signal that's coming from the nerve. And so CBD, at least from what we know about that, does have some protective qualities. Doesn't mean it's fixing the issue, but CBD is an effective way to start thinking about it.
And we have products that deal heavily in CBD too, along with THC combined. So we have gummies that are 1-to-1 that you can use. We have tinctures that run from anywhere from 1-to-1 to 1-to-10 with 10 parts CBD. So we have options for patients that want to try these CBD methods. And combining it with THC is really the key and the sweet spot because you get that pain relief from the THC itself.
Are you always recommending at least 1-to-1 to 10-to-1 CBD to THC?
If it's available in that dosage form, I do. Yeah, THC.
If it's available in the dosage form. So again, I come in with my condition.
Yeah.
I have an expectation of what I want to get out of it,
Mm-hmm.
and then we're going to look to delivery methods.
So like a vaporization
and
cart's not going to have a lot of CBD in it. Most of the vape carts produced here in Utah don't have a lot of CBD in them.
I'm so excited. We have a 1-to-1 coming out.
Yes.
THC, CBD.
And I'm so excited for that product because it's going to help a ton of our patients. But we can, tinctures are a great spot for that,
What about other cannabinoids like CBG? Not so much for neuropathic pain, or would you stick to CBD first?
So CBG has a higher ability to remove inflammation. And so as a result of that, if your neuropathy is partially associated with that, I think CBG could be very effective. But CBG is not going to go in and inhibit that one particular pain signal. And so I think in that particular case, CBD is more effective. And so that's where you have to work with your doctor and your pharmacist to identify what is the cause of this. I mean, neuropathy associated with diabetes is significant because, that's a result of damage on the nerves themselves. I don't think CBG is actually going to help that.
But we have options too. Where I'll recommend to some of our experienced users that are using flower to cut it with CBG. We've got CBG options that they can, and that kind of adjusts that ratio that we talk about and having that higher CBD ratio. So there's options for people in that situation if they want to try it.
So today we talked a little bit about neuropathic pain and what cannabis products to use or to choose if you have neuropathic pain or neuropathy. Primarily, we're choosing delivery methods that affect us in the time frame that we want. Inhaled methods are going to affect us quicker. They might not last as long. Long-term, like a gelatinous cube or a gummy, that's going to take a little while to take effect, but it's going to last a little longer. Look for products with a ratio of THC to CBD of at least 1-to-1, with higher levels of CBD helpful for the neuropathic pain. CBG can be helpful if the pain is related to inflammation, but doesn't necessarily fix the neuropathy that you're suffering from. This has been another episode of Discover Marijuana. Thanks for watching. Comment below if you've got a product that you really like for neuropathy, or if you've found success with cannabis and in treating your neuropathy.